For an injured worker relying on the compensation system, recovery feels like a tightrope walk with a safety net beneath them. But with a single declaration from a doctor, that net freezes completely. One medical note determines when those benefits stop and whether the worker can legally return to their old job. That declaration is known as MMI, or Maximum Medical Improvement. And before we get into the mechanics of how it works, keep in mind this is general educational information, not specific legal advice. Many people hear the word improvement and assume MMI means they are fully healed. It does not. MMI is simply the point where a condition stabilizes. It means the injury is not expected to get significantly better, even if the worker receives more curative treatment. It marks the end of improvement, not the arrival of health. This creates a precarious reality. A worker can reach MMI while still suffering from chronic pain or severe mobility issues. Once that declaration is made, the system legally treats that pain as their new, unchangeable baseline. Because MMI carries such heavy consequences, the law requires a specific chain of command. An employer cannot declare you are at MMI. A nurse case manager cannot make that call either. Only the authorized treating physician, the doctor actively managing the patient's care, holds the legal authority to determine that healing has plateaued. But that authority is constantly under pressure. Workers frequently fall into the early MMI trap, where insurance companies pressure the treating physician or hire their own outside doctors to rush the MMI declaration before the worker has actually finished healing. The motive here is purely financial. While a worker is recovering, the insurer is on the hook for surgeries, extensive physical therapy, and weekly wage replacement checks. An MMI declaration legally cuts off the obligation to pay for those curative measures. Whoever controls the MMI date controls the money. If an insurance carrier succeeds in rushing that timeline, they save thousands of dollars on medical care, while leaving the injured worker with physical deficits and a lower total compensation. To prove a worker has hit this plateau, doctors rely on objective physical evidence. They compare chronological MRI scans taken over several months. If a fractured bone has mended as much as biologically possible, or soft tissue damage stops showing active changes, the physician has the structural proof needed to certify the condition is no longer in a state of flux. But the workers' compensation system also legally recognizes injuries that don't show up on an MRI. Mental trauma resulting from a workplace accident, like depression or anxiety, must also reach a measurable plateau before MMI can be declared. This chart shows how clinicians track that psychiatric recovery over time using the PHQ-9, or Patient Health Questionnaire 9. By plotting a patient's score on a timeline over several months, doctors can identify exactly when the score stops fluctuating and begins to level off. On this scale, a score over 10 indicates moderate depression. If the data points are consistently sitting above that threshold line month after month, the flattening of those scores gives the physician the objective proof they need to confirm psychiatric stability. Firm, decisive tone. Once these physical scans and mental scorecards plateau, the worker crosses a point of no return. Their medical reality is now locked in for the legal system. This initiates the core pivot of the entire workers' comp process. The exact moment MMI is reached, the primary goal of the claim shifts. It transitions away from medical healing and turns directly into mathematical calculation. The doctor is now required to assign an impairment rating. They must evaluate the residual damage and assign a strict percentage representing the functional physical loss of a specific body part, or the whole person. This percentage determines how the worker is classified. The most common classification is permanent partial disability, or PPD. This means the worker has a lasting impairment, like reduced range of motion or chronic joint pain, but they still retain the physical ability to perform some job duties. That is different from permanent total disability, or PTD. This classification is reserved for catastrophic injuries, such as severe brain damage, paralysis, or the loss of multiple limbs. It means the severity prevents any gainful employment, which often triggers weekly benefits paid for the remainder of the worker's life. An impairment rating strips away the subjective human experience of the injury. It reduces a lifetime of restricted movement or pain into a percentage score, which the state uses to set the final settlement amount. Reaching this mathematical phase stops the temporary wage replacement checks that sustained the worker during active recovery. The worker is then transitioned to permanent disability benefits based on their newly assigned rating. But these permanent weekly amounts are often capped at a figure significantly lower than the temporary benefits they were just receiving. There is a medical exception to this cutoff. Even though treatments meant to fix the injury stop, the insurer remains legally obligated to cover maintenance or palliative care. This includes prescriptions or therapy required to manage the ongoing pain. On the employment side, the worker now faces 3 strict paths forward: returning to their old job with no restrictions, returning to mandated light duty if they have partial impairment, or entering vocational retraining. The worker is suddenly receiving less money each week and facing an uncertain job market. Because the injured worker is financially vulnerable, this is the exact moment insurance companies typically strike with their lowest final settlement offers. To protect your rights, use this checklist. Step 1. Confirm the source. Verify your authorized doctor signed the MMI date. Step 2. Check the math. Request an independent medical exam to challenge inaccurate ratings. Step 3. Protect future care by securing lifelong palliative costs. The MMI date marks the transition from active medical care to the final negotiation over a lifelong disability settlement. If you want to understand more about the hidden mechanics of complex legal and medical systems, subscribe to The Explainer. We'll see you in the next breakdown.